Okay, thank you. Nhlaga, any indication on Jozi FM?
Madam, they're wrapping up an interview. I think let's start, and then they will find us as soon as they come in.
Because you know when they come in with a bang. So they come in with a bang, so they will actually disturb the process. They will disturb the proceeding of the meeting.
Unless, madam, we can just mute them as they arrive so that they don't disturb. Yeah.
Yes, please, let's do so. However, for the benefit of our viewers and followers, we'll have to start right on time. It's now 18:30. Good evening to our beloved guests and residents at home who are tuned in on different social media platforms and radio stations. Ladies and gentlemen, welcome to my weekly show known as The Talk with the Speaker of Council. My name is Nongceba Mulwele. I am the Speaker of Council in the city of Johannesburg. Please do follow me on my own social media page, which is Nongceba Mulwele on Facebook, and at speaker_COJ on Twitter, as we are live on these platforms. Ladies and gentlemen, I start today's engagement with great sadness. As most residents would have already heard the news of the loss of our beloved executive mayor last week, we continue to mourn the death of this great man and wish to take this opportunity to observe a moment of silence in memory of our late Mayor Councillor Jeffrey Makubo, who was a true servant of the people. May I request that we take a moment of silence. Thank you very much, ladies and gentlemen. May his soul rest in eternal peace. Residents of Johannesburg, ladies and gentlemen, we are in the month of July, and once we celebrate Utatu Madiba, one of the greatest men to ever live, we also observe this month as Men's Health Month. The purpose of Men's Health Month is to heighten the awareness of preventable health problems and encourage early detection and treatment of disease among men and boys. This month gives healthcare providers, public policymakers, the media, and individuals an opportunity to encourage men and boys to seek regular medical advice and early treatment for disease and injury. The response has been overwhelming, with thousands of awareness activities in the globe. Tonight, ladies and gentlemen, we will focus on prostate cancer in particular, because this is the most common male cancer globally and locally, and is showing significant increases according to the National Cancer Registry. Given our partnership with Dr. Fundile Nyati and his partnership with AstraZeneca on the Pagamisa project, we thought it relevant to elevate this issue, not only to create awareness, but to also bring the city into the picture to see how best we can collaborate to ensure that more men get screened and that more lives are saved. I take this opportunity, as always, to thank our host and partner, Ipelelethu, Dr. Fundile Nyati, for providing us with this platform. Let me also thank our radio partners, Jozi FM, as they are making their way to the show, Eldos FM, Chai FM, and Pulse FM, who continue to support us in our endeavor to educate our communities on various topics relating to council business. And thank you very much to everyone who has joined in for today's engagement. I also send a special message of support and strength to Alex FM, who are also our partners and who have been carrying our civic education messages. Alex FM ladies and gentlemen, were terribly affected by the looting incidents in Alexandra Township. And I call on all of us to offer them all the support we possibly can, because community radio stations are the backbone of civic education, as we have come to learn. Let us move towards rebuilding our city and encouraging social cohesion towards a peaceful nation. With that said, it gives me the greatest pleasure to hand over to Dr. Nyati this evening to introduce the panel and lead our discussion tonight before we hand over to Umoshe of Jozi FM for an opportunity to engage our panel as well. I've heard that Jozi FM today only, or this evening, only have 30 minutes. They normally have an hour, so they only have 30 minutes this evening. I introduce a man, ladies and gentlemen, who needs no introduction, because our regular viewers and listeners of the show already know him. But for the purpose of our new audience, Dr. Nyati is our partner in the City of Johannesburg Civic Education Engagements. He is a medical doctor, qualified specialist and family physician. He is also the founder of Proactive Health Solutions. Dr. Nyati, Bele, let me hand over to you.
Thank you very much, Speaker. I always find it difficult when people, say things about myself. I'm more happier saying things about other people. But anyway, thank you very much, Speaker, for allowing us, to focus on this issue that is quite serious, the issue of men's health in general and, cancer of the prostate in particular. But before I just make my opening remarks, I just want to welcome the panelists. I'll start with Ms. Barbara Nell, the boss. She doesn't like me to call her boss, but the MD of AstraZeneca and the Africa region, because the Pakamisa project, which she will talk about, is actually, within, her area of responsibility. And she'll talk more about that. And within that program, the cancer of the prostate is actually, one of the key deliverables, or key performance areas, the other being CA of the breast, but that's not what we're talking about this month. And then I'll go to my extreme left, Dr. James Uri. Dr. James is a qualified specialist urologist who got his MPCHB degree from Wits University. He was not happy with just, having MPCHB. He decided, to go and specialize in urology. And so he obtained his fellowship in the College of Urologists of South Africa. That was around 2013. He then got an interest in doing research in the space. And so he got a Master of Medicine in Urology from UKZN Medical School. And later he went for a 6-month stint in the UK to be on the cutting edge in the urology space. That is to do robotic surgery in the area of urology. And his special interest is that, of uro cancers, that is cancers in the area of urology, and also in robotic surgery. So he will be sharing some information, later in the program. We've also got Dr. Silom Daung. He needs no introduction because for the last 10 years or so, he's been the host of health talk show on SABC, SABC2 every Saturday. But he is here today to actually share, about his journey with, cancer of the prostate. He's actually a survivor. And at the time he needed to be treated, he had to go to Germany to do robotic surgery because at the time South Africa was not yet, ready to offer that kind of intervention. But he'll share his story a little later. You will introduce Mr. Mazibuko, but Mr. Mazibuko is part of the city of Joburg. He's a senior manager. The area of health services and the running of clinics and other aspects related are under his area of responsibility. And so he will share how his clinics can actually be used as places for screening and also of community mobilization as far as CA prostate and also CA breast are concerned. I think let me end there. All right. Joseph, I cannot see them here. I saw them earlier. So Mhlaka, if you can try and promote them so that they can be able to run with the questions. Just some opening comments from me.
They are in the room, Doc. My apologies. They are in the room.
Oh, yeah,
if we can hand over to them. Moshe, over to you.
Thank you so much. Thank you so much, Joseph and family member. We just joined our discussion this evening, as you have heard from Dr. Fundi there, Fundile Nyati, giving just an overview of what will be happening this evening. We'll be with you up until 7 o'clock this evening. But let me just quickly start our conversation. Maybe we can talk to Mam Barbara Nell. Maybe she can give us a bit of an overview. She can kindly take us through or give us more about the Pagamisa project and how government and civil society can get involved as maybe give your opening remarks and also give us your comment on that particular question.
Thank you very much, and good evening to all the listeners, and thank you so much for this opportunity for us to be here. The Pagamisa program from AstraZeneca has been running for 11 years. It started initially focusing in breast cancer, but very recently we have also moved to prostate cancer and the focus on prostate cancer, one of the shy cancers, as we often call it. And I think it was an easy transition for us because of the numbers. There's more than 4,000 patients who get newly diagnosed every year with prostate cancer. And we know in the region of about 5 men die every day in South Africa because of prostate cancer. So for us, the Pagamisa program is all about public-private partnerships. And for us, this is very important. And this is also the area where we are specifically focused with the Pagamisa program on the patients who get managed within the public sector or the state sector here in South Africa. And the program essentially, it hinges on 3 pillars. The first pillar is about raising awareness. So this is where we are raising awareness in terms of the signs and symptoms that people need to look for. We run days where we get specialists and people from the community in communities to come and talk and to discuss the signs and symptoms and the treatment options that patients might have. Just recently, we held the Saturday before Father's Day, we held a very successful event in Soweto, where actually during that day, we had nearly 150 men who were also screened for prostate cancer. So that's the first pillar around awareness. The second pillar is around education and training specifically for healthcare professionals, where we are looking at nurses and other individuals, community healthcare workers, and what more we can do to also upskill them to work in their communities and within the hospitals or the smaller clinics where they might be working, to be able to identify the signs and symptoms of cancer and prostate cancer so that they can identify the patients earlier. It's such a big problem that we have very often, especially with something like prostate cancer, where patients get diagnosed very late. And the earlier we are able to diagnose patients through the awareness, as well as the education, we can have a better outcome. And then the third pillar around the Pagamisa program is around access to care. And as in many countries, we know that there are often challenges between maybe the local clinic where a patient might initially go to for discussion around some signs and symptoms that they might be having, not maybe even knowing that it might be cancer yet, to either then get diagnosed or referred to a district hospital, to eventually then get sent to the tertiary hospital if that is what is needed. So we are also doing a lot of work at the moment through public-private partnerships to look at how we can also help to facilitate the steps that the patients need to go through from when they maybe initially start showing symptoms to then getting diagnosed to then having the treatment optimized. You know, my colleague Ruth Field, who's also online this evening, she is really the passion and the energy behind the Phakamisa program. And I know feels very passionately about sort of the involvement around, you know, and also looking at civil partnerships and how the government and with the work that we are currently doing with the government and with the Department of Health here in South Africa, what more we can do there. And I think also, you know, the partnership with Proactive Health Solutions and Dr. Fundi, you know, with your channel also gives us fantastic platforms where we are able to talk to people, potential patients, you know, carers, family members of people, to just continue to raise the awareness around areas such as prostate cancer. Thank you very much.
All right, thank you so much, Branel, for that opening remarks. I think as looking at the time, I'm just going to quickly involve Dr. Silo Mutaung. I know he, over and above the work he does in the health sector, but he's also a prostate cancer survivor. So may he kindly share with us his journey on that particular note. Can you kindly unmute, Doctor?
My apologies. Thank you very much for the invitation. And yes, besides, you know, doing other things, I guess I'm here to just share with you my journey through prostate cancer. I was diagnosed with prostate cancer early in 2011, at the beginning of the year. You know, the year had just started. And Dr. Nyati would remember that during our medical school days, one of those that, you know, had tried by all means to live a healthy lifestyle. So at the beginning of the year, you know, I went through my routine kind of, you know, screening, just going for a, you know, normal check. I had no symptoms. There was absolutely nothing wrong with me at the time. I just, you know, went to a doctor just to get checked. And one of the tests that were done on me was a test called PSA. And I'm sure we'll hear about it later from our expert, Dr. Uri. And essentially that, you know, came back high, suggesting that I may be having cancer in my body. And of course, you know, because we don't have a lot of time, so I'll cut the, you know, a long story short. We went through ways of ensuring that we exclude all other possible causes of a raised PSA. And, you know, after a while, we repeated the test still came back high. And then I had to go for the definitive test called a biopsy, where, you know, one goes into theater and pieces of the gland, you know, gets taken from you to be examined in the laboratory. And that's how my cancer was confirmed. And, you know, we went through a process of what's called staging of the cancer to determine whether or not the cancer had, you know, spread beyond the prostate gland, and if so, to what sort of organs. And unfortunately, what was then determined at the time was that the cancer was confined to my prostate gland. Something called the Gleason score was then reviewed, which is something again that Dr. Uri perhaps, you know, will touch on. But essentially that will tell you to what extent, you know, the prognosis is, you know, going further, which we'll talk to what sort of treatment one gets. Obviously, it's not an easy thing to deal with, the fact that, you know, you're told you now have cancer and something needs to be done. But obviously, as I said, the good news was that, you know, it was still confined to the prostate gland. And at the time, you know, we looked at all possible, and of course, being a medical person myself, I had to read quite a lot and, you know, research to look at what's available, what the current information that's available on you know, treatment of prostate cancer. We viewed all of these options, and you know, it was quite clear at the time, because, you know, it was on both sides of the gland, and the only way to sort the matter out and save my life, so to put it, was to have the prostate gland moved. And you know, the way at the time, you know, something that was relatively new in some countries, had not been introduced in our country, but was already in operation in Europe. And that's why, as Dr. Nyati said, I ended up in Germany for robotic surgery to have the gland removed. But I'm happy that we do now have that kind of a treatment option available in our country, and that in a nutshell is my journey through prostate cancer. And I'm happy. I mean, we can chat about any aspect of what I've just shared with you now. Thank you.
Yeah, Doc, it sounds very scary, and that you had to go through that. Of course, just looking at the time, I would just like to include Uba Mazibuko, just for him to, before we leave this broadcast, how can we encourage more men to get screening regularly? And if abantu bafuna ukuya ezindaweni la bazothola le ama-test baya kuphi? Mazibuko, maybe you can share that with us for our family members.
No, thank you very much, Mr. Broadcaster. I just want to. My name is Vusima Zibuko, and I'm the head of health in the region East City of Johannesburg, and I oversee the area Sandton and Alexandra. But certainly, as people would know, I mean, in the clinics, we're running primary healthcare services. I'm just a bit worried because my picture doesn't look very well there. It's slanting, but we'll fix it in another day. So we are running clinics there, and men's health is one of the most key important areas. Sometime, I think, it should have been now 2010, we realized that men are marginalized and men, their health needs are not taken care of. And we took a conscious decision to say, we are going to invite and encourage men to come to our clinics so that we do the screening. As you would know that in the clinics, primarily we emphasize on the prevention and promotion. So we encourage men to be coming to come and screen, do the PSA test, do what we call the digital rectum examination, the DREV, and also just to promote health. And since we started, in our clinics, we have established what we call men's corner. There are clinics like River Park where we literally designate a place for men because men have got all sorts of excuses. They will say that they don't want to come to the clinics because they are handled by females, predominantly in the primary care setup, it's nurses. So we make it possible that there are male nurses in our clinic so that they can attend to men's issues. So we've got the men's corner, which we encourage men, and we have seen it to be very, 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 very encouraging. The results we are getting, men are forthcoming to our clinics. Over and above it, I think people would have seen some other programs which we have flighted. There is the Mina campaign. Mina is just a Zulu name with Mina and myself. So it starts with myself. So we've got those MENA campaigns going on. I mean, people might have seen some billboards and other things where we encourage men to come forth in the clinics, not only for the prostate, even for the other health needs, like for instance, STIs, HIV, even the GBV, the gender-based violence. So we're doing those campaigns. And beyond that, we've got what we call the Welcome Back campaign. I think people know that we had this pandemic and people were frowning to come to our clinics. They were very, very hesitant. So we've got the Welcome Back campaign where men and other and women also, they're encouraged to come back to our facilities so that they can get taken care of. Also, over and above what we're talking about, which is prostate, we have realized that also there are men's issues like the mental health. Men, they complain, they get involved in GBV and other things because of mental health. I think one day, some other time, we'll get an opportunity to address those issues and say, how best can we help men? So in that, I would just say that, and lastly, in fact, just to share with the audience, is that on the 6th of July, we intended to launch through the executive mayor, the late executive mayor, we're supposed to launch what we call the Men's Parliament. And the Men's Parliament is under the Johannesburg AIDS Council. So we wanted to launch that Men's Parliament where men can discuss openly about their issues. So it's one of those things which in the not so distant future, you'll be seeing that coming forth and people will be told about it. I think I'll end there and hoping that I'll get another chance just to share of some of the things we're currently doing in the primary healthcare facilities. Thank you.
Thank you so much, Mr. Mazibuko. With that opening remarks, 6 minutes just before the hour, 7 o'clock, right here on your number one dial. This is Joseph, and we're having our conversation with a panel that is organized by the Speaker of Council in the city of Johannesburg. I'm going to just quickly involve Dr. Ronald James Uri. Doctor, maybe you can just tell us, is it that whether are men adverse to screening for cancer? And if so, what is the cause? Is it fear? And is it a lack of awareness? What is it that is surrounding this? I know when Dr. Mutaung spoke about his journey, I was shaking a bit because if it was me, I don't know what would I do. Maybe you can talk us through that, Doc.
Sure. Thank you so much for having me this evening, Madam Speaker, Dr. Mazibuko, Dr. Nyati, Dr. Mutong, and all the listeners, Josie FM, Eldos FM, Kai FM, Pulse FM, and Alex FM. Let's get straight into it. Why don't men come for prostate cancer screening? Some of it is fear. I think as men, we don't like having to go to the doctor. We feel that we are weaker if we go to the doctor. There's also the fear of what we may find when you go to the doctor. Could it be prostate cancer, something that we have to worry about? And then there's the fear of this digital rectal examination, which Dr. Mazibuko mentioned, the idea that someone's going to examine you rectally. And that really isn't something to be scared of. So maybe one thing I can do for our listeners tonight is to put your minds at ease. If you go for prostate cancer screening, the digital rectal examination is important, and it is not painful. It's not scary. It's not terrifying. It takes literally a few seconds, and it gives the doctor the opportunity to physically assess the prostate as well as with the blood test. So I would really encourage men not to be scared to go for screening and testing for prostate cancer. There's nothing to fear. And it's important to catch cancer early rather than late when it's too late to do something. So I agree with you. As men, we are all scared to go and get tested, and we shouldn't be.
All right, Doc, before we leave, let me just play some of the comment from our family members so that we can hear what they had to share with us.
Good evening. Thank you so much, Madam Speaker, for hosting a fabulous show. I just want to encourage more men to go out there and know their statuses. We know that Men's Month is not celebrated such as Women's Month. They shouldn't feel degraded or not wanted or not accepted as much as a majority of women. They should go and know their status. They have a right to a better, healthy lifestyle. They need to exercise, eat healthy, less drinking of alcohol, more drinking of water, eating a healthy diet. And by doing so, they're encouraging upcoming future men to do the same thing. Thank you so much for Jose FM and Dr. Fundi. Thank you so much.
For men, it should not be a challenge to take care of themselves. If they feel that their body is giving up on them, is shutting down on them, then it is their responsibility to do something about it. Visiting the clinic does not mean that a man is weak, but it is just for their mental, physical, and spiritual wealth and health. Basically, all I'm saying is that every man has the right to take care of themselves as much as women take care of themselves. I mean to say, at the end of the day, you are human as much as a woman is human. So a woman who is human can also take care of themselves. So as a man, all I can plead is that please take care of yourself for the sake of your family, for the sake of the future. I know that most men, they wish to see their 3 generations, which is a blessing in disguise. So all I can say is that it is a great thing when a man takes care of himself.
Of course, so the contributions from our listeners, hearing a woman encouraging us men to go and get tested. I think on that note, Madam Speaker and Dr. Fundi Nyati, I will just park it there, and I will just hand it over to you as you proceed with the broadcast.
Thank you very much, Jose FM. Thank you very much, Moshe. We hope that next week you will have more time with us as usual. Thank you very much. Before we go to our viewers and followers and hear their comments and questions, let me do a follow-up on the question that was responded to by Dr. James and refer this question to Mr. Mazibuko. Mr. Mazibuko. Okay, you're living with a bang. Mr. Mazibuko, you have made mention of your campaigns, the campaigns that you are doing, the MENA campaign, the Welcome Back, and all the campaigns that you are doing at the primary healthcare level. The question I'm having is, do you get the response? Do men then come to the facilities for screening in numbers? I heard Dr. James said that men don't necessarily averse to screening because of fear and that, but do you get the response? Do you get more men than responding to the campaigns and coming to the facilities?
Thank you, Madam Speaker. As a response, certainly since we started, I think we started, like I said, more or less 2010. It's not like before we never used to do men's clinic, but in a focused manner, we started then. So we started in clinics like 8th Avenue where we decided to have we used to call it men's clinic, but currently we call it men's health. So we've got what we call it the men's corner in River Park and other clinics. And since we started with that, we're seeing so many men coming forth. But just to be precise, in Alexandra, we've got what we call it the men's forum. There are about 1,000 in total, people who are really leading the pack so far as men's health are. And whatever campaigns we've got, we channel through those people because it's better when men speak to another man. So we find it to be very, very helpful. And by so doing, we have realized that, I mean, if you can look at most of the PSA test results we get and how many people we have prevent from getting full-blown prostate cancer, it's quite a lot of them. So we really find that it really helps. We know that with pap smears and other things with the female gender, definitely it has been working, and we try to prevent the cancer of the cervix and other things. So definitely we're seeing men coming. They're not coming like we would like to. And I know that there's been a dampener again with regard to the pandemic, but they're still forthcoming like in clinics, and the numbers, we've got the statistics, and it really assists us since we started with these campaigns. Thank you.
Thank you very much. Thank you very much, Mr. Mazibuko. Dr. Nyati, maybe before we also go to our viewers, I think it will be important maybe to just give a synopsis or a brief to our viewers who are not necessarily in the medical space on what is prostate cancer and what are the symptoms, what are the signs. I know that Dr. Mtaung, as he was outlining his journey, tried to explain a bit what was happening in his life and the change on his body. But what is it? What are the signs? And what is it that men should look for them to suspect that maybe they might have prostate cancer?
I think it would be better. I've got a more learned friend here, Dr. Uri. Let him answer. He spent more time at medical school and beyond. So I think he's the most appropriate person to answer that question.
All right, thank you. Dr.
Madam
James?
Speaker, Fundile, thank you. I think the tough thing with prostate cancer, as Barbara said, is it's one of the hidden cancers. So in most men who are diagnosed with prostate cancer, there are no symptoms. And when we do have symptoms in a disease like prostate cancer, it's often because the cancer has become advanced and is invading into the bladder or into the bones and starts causing pain. And by then it's often too late. And that's why Selo made the point about screening, because the only way we pick up this cancer when it's still early enough is to do screening tests. And that's why as doctors, we recommend men to come in for prostate screening from approximately the age of 40. What's quite interesting, Madam Speaker, is that we've seen that in men of African descent, and we see this in South Africa and other African countries, in African Americans and in Europeans of African descent, that prostate cancer is actually more common. And there's a study on the go at the moment involving Mr. Falco Machato, Health Sciences University, where I work with Prof. Mutambirwa and a couple of other centers around the world, and we're looking at why this is the case. But what's really important is that men of African descent get tested from the age of 40 years. And that's why Dr. Selo Matong got diagnosed, because he went for his routine medical screening and they picked up that the PSA test, which is the test we use for that screening, was high, and he was able to detect his prostate cancer early. If he had waited until he became symptomatic, and I'm going to really emphasize this, Selo said that he had absolutely no symptoms, and that's the point. If he had waited until he became symptomatic, he wouldn't have been cured from his prostate cancer, and that's why we put the screening. I hope that answers your question, Madam Speaker. Fundile, I hope if you want to add something, please feel free.
No, I think for now that's okay.
Certainly it does. It does respond to my question. Thank you very much. Maybe let us hear from our viewers. Any questions on our social media platforms as well as on the chat group? Ntlaka or Sipho?
Good evening, Madam Speaker. Thank you very much. We do have some comments on social media. Thank you very much to Elders FM, who is still with us at the moment, Madam Speaker. Just looking at the questions, people are appreciating the comments, the discussions this evening. Teboho Pagati says, why do men die younger than women? And then we've got IV Motake says, what are my chances of developing prostate or testicular cancer? Dan Sibanda says, great conversations. What are the signs for poor health? Brendan Jovu says, is it okay to cleanse your body by fasting from time to time? Does it help or does it help and make your body, I can't make up what they're trying to say, madam. But does fasting help in any way? I guess that's what Brenda's trying to say. And then Teboho Sukobo says, what do I do if I think I have been exposed to a sexually transmitted disease? I don't know if it's got to do with the conversation tonight, but I guess that's a men's health issue. Abel Motaung wants to find out about depression from a men's health point of view. And he says, we all feel down from time to time, but how do I know if I am depressed? And then Bongani Masuku says, what is my prostate and why is its health important to me? I think those may have been answered, but perhaps the panelists can assist with responses to those. I'm going to leave at that for now, madam, and maybe I can read them later again. Thank you, Madam Speaker.
All right. Can you also read on the chat group? Because I saw one of the messages asking how often should the prostate cancer be done on the chat, so that when the doctors and the experts respond, they then include that as well.
Okay. I see, I just want to see the comments. This one says, hello everyone, Leslie, what foods can be helpful, to just name a few? And then also they ask about the approximate age. And then there's another one that says, concerning nutrition, is there any chance that nutrition can contribute towards prostate cancer? The next one from John Mukwele says, how often should tests be done? And is the PSA and DRE done at the primary healthcare facilities? The next one from Andrew says, great initiatives that is being run by Vusi and his team in Alex, where men can go for prostate cancer screening. What about other areas in Jozi, in other provinces? And then Itumeleng says, Dr. Sello, Yuri and Fundile and Vusi, thank you. It's quite informative and helpful. Prevention is better than cure. I think those are all the comments from the chats, madam.
Thank you very much, Sipho. Let me then hand over to our panelists to respond. I am not going to mention which question should each panelist respond to, but I know that there were some questions that were directed to Dr. Fundi as well as to Mr. Mazibuko on the primary health care as well as what is happening in Alex. All right, who goes first? Dr. Nyati?
Let me take the easy question. The easy one is that, yes, men in general, they die at least 5 years before their wives. And this is a global trend, all right? And part of that, obviously, is that as men, we do not, we don't prioritize our health. We don't put our health first, we put it last. We tend to avoid going to healthcare professionals. So our help-seeking behavior in general, is not so good. And by the time we do go there, usually things have progressed. And so, when one looks, from infancy up to old age, generally, women are simply healthier than men. Of the top 15 leading causes of death, men lead women in all of them except Alzheimer's, only because we don't live long enough to show up, with that one. So yes, our behavior and our attitude to our health actually makes us to be at a much higher risk as men, which is why women and our wives, they actually tend to live longer than us. I think that's the question I thought I needed to answer. Last year, I hosted a physiologist from Wits who actually mentioned that there is a benefit to fasting, because it does help the body in terms of regeneration of cells. But obviously, it's not something that we can do every day. But, he mentioned that they've got scientific proof that fasting does help, in the body to heal itself. I'll leave it at that.
Wow, thank you very much. Fasting, okay. Thank you very much. I think some of us now we are going to begin to fast sometimes. And Dr. Mtau, I see you have unmuted.
Well, it's probably my overactive fingers, but I mean, I can comment. But by the way, we do fast on a daily basis. When we are asleep, we break that fast in the morning when we eat. The subject of nutrition is a little bit of a controversial one because, people, view all different types of nutrition practices, differently. Some will believe that, for instance, when it comes to managing weight or losing weight, there's all sorts of advice that people get. You get things such as intermittent fasting and so on and so forth. So I think generally what we say is try and stick to a healthy diet and just generally live, healthily. Everything in moderation. Try and eat lots of fruit and vegetable. Be physically active. If you're not too sure whether or not your diet is adequate, perhaps if you're able to visit a dietitian to get some sort of advice on how best to approach the whole question of nutrition. I'm not going to try and address some of the questions because I think Dr. Uri is best placed to do that. For instance, things such as how would I know if I have an STD or a sexually transmitted disease in a male? It's probably easier, and it may not necessarily mean that it's a sign of prostate cancer, but you can either and again, in relation to when you would have had sexual, intercourse with someone, you might experience burning when you try and pass urine, or you might see some discharge that you don't normally see on a daily basis, or you might see some sore that is developing, on your male private part. But as soon as you see something that is unusual, it's always best to to consult your doctor as soon as possible, I think. And that's where I want to emphasize that, as soon as you see something that is unusual in your body, it's best to, consult your doctor as soon as possible. Of course, also just to emphasize, and I, want to repeat my story, the importance of screening. Once you hit the age of 40, it's best that you do this prostate cancer screening at least once a year, well, not at least, once a year. And especially if, you are high risk. And I think I want to give it over to Dr. Uri to talk about the risk factors, because there was a question on risk factors, because, the guidelines now say something about the frequency of screening in relation to, risk factors. And I don't want to complicate the story any further. I'm sure Dr. Uri can simplify it for us. Thanks.
Okay.
Thanks, Silo.
Dr. Uri?
Thanks, Madam Speaker. I'll try and address the urological questions which the viewers have raised, and they're all excellent questions relating to men's health. Maybe just to close out the sexually transmitted infection question quickly, because it's not that relevant to prostate cancer. I agree with Dr. Matong that if something is unusual on your body, you should have it checked out. Why I specifically emphasize that is because one of the cancers we haven't spoken about, we've mentioned testicular and prostate cancer, but men can also get penile cancer. And so a lesion on the penis which is not healing can be a precursor to penile cancer, and it should definitely be checked by a doctor. And also it could be human papillomavirus, which can cause cancer of the penis. So once again, that should be checked. Let's move on to the prostate cancer side of the discussion. And perhaps before we talk about screening, when to screen, risk factors and screening frequency, I'd like to go back to the very good question, what is the prostate and why should I be concerned about my prostate health? So let me try and answer that first. And I welcome any of the other colleagues on the webinar to chime in if you would like to. The prostate is a gland. Glands produce certain fluids within our body, and this happens to be a gland which is only found in men. It's found at the base of the bladder, and the urethra, the pipe which we wee through, we pass urine through, goes through the middle of the prostate. And that's just the way we designed. There's nothing we can do about that. The prostate's job is to produce fluid, which we ejaculate when we're sexually active, and that's the fluid component of semen. The sperm come from our testicles and they mix with the fluid from the prostate, and that's what we ejaculate. So the prostate has a very important function in terms of reproduction and sexual function in men. And without the prostate, we cannot reproduce, we cannot have children. So it's very, very important. Two things happen to a man's prostate as he gets older. It happened to Dr. Matong, it's happening to Dr. Fundile Nyati, it's happening to me. Every man who's got a prostate experiences two things. One is enlargement of the prostate, and that's just a natural aging process. And the second is an increasing risk of prostate cancer with age. And as the speaker said right at the beginning of the meeting, prostate cancer is more common as we get older. And that's why we do the screening tests as men get older. So we can come on to screening, which is really what the key discussion is around, I think. And I see a question just popped up about the cost of PSA, so I'll try and answer that to the best of my ability as well. The test we have for screening is this test called PSA, which stands for prostate-specific antigen. The first point I'd like to emphasize here is it's not prostate cancer specific, it's just prostate specific. And Silo mentioned this in detail when he talked about his journey, that when we find a man with elevated PSA, it doesn't mean you've got prostate cancer. All it's doing is raising a red flag for us as doctors or healthcare workers that there's something going on with the prostate and we need to look a little bit harder to check that there's not prostate cancer present. As Stella mentioned, there's lots of other causes of a raised PSA. They include things like infection, inflammation, prostate enlargement, prostate obstruction. So when you have a raised PSA, it doesn't mean you must panic. It doesn't mean you've got prostate cancer, but it does mean that you may have prostate cancer, and that's why we need to look a little bit harder. We do this blood test as well as the digital rectal exam, as we discussed earlier. The correct age to do it at is the age of 40 in men of African descent, so black men, and that's because I mentioned earlier there's a higher risk of prostate cancer in these men. Also from the age of 40 in men who have a family history of prostate cancer. So if your father's had prostate cancer, or if you've had a brother with prostate cancer, or if anyone in your family has had prostate cancer under the age of 50, it's important to be screened early. Men of European or Indian descent can be screened from the age of 45. And if the first screening test puts you at low risk, then you can probably be screened again in 2 to 5 years. But as Selo correctly said, particularly in men who are at higher risk, we should have a screening test once a year to assess the risk of prostate cancer. In terms of what a PSA test costs, perhaps as well, Dr. Maziboko can chime in here, but I think if you go to a government or City of Johannesburg healthcare facility, the test will be free. I'm almost certain of that. Perhaps Dr. Maziboko can just confirm that. I think if you have it done in a private laboratory, it's about 350 Rand. And your general practitioner can order it, a specialist can order it, but certainly you don't need to come to a specialist urologist to be screened for prostate cancer. All doctors can screen someone for prostate cancer with a blood test and with a rectal exam. Fundile, Selo, would you like to, Vusi, would you like to chime in anything there?
Maybe before Mr. Maziboko comes, before you get off the stage, Dr. Uri, there is a question that asks how true is the fact that engaging on frequent sexual activities can lessen the chances of getting prostate cancer? I'm asking that question, directing it to you because you have already spoken about sexual activity. So there's a question there.
Yes, thanks, Madam Speaker. And this lines up with what's the risk of prostate cancer? Well, it's a very good question, and it's a question which was covered a lot by the lay press, which is why people know about it. Yes, there's a study which has been published which shows that frequent ejaculation reduces the risk of prostate cancer. It doesn't say how you should achieve that frequent ejaculation. I'll leave that up to the listeners to decide for themselves. But certainly they put a number on 21 activities per month to reduce your risk of prostate cancer. If the listeners out there are sexually active 21 times a month, then they're doing very well. I think they're doing better than I am. But if you are frequently sexually active, it allows the prostate gland to empty its secretions. The inflammation is much less. And I think that's the reason why we believe that frequent sexual activity reduces the risk of prostate cancer. Remember, the study which that's based on is a looking back study. So they looked at men who were diagnosed with prostate cancer and who were diagnosed as not having prostate cancer and looked at the number of times they were sexually active. So there are factors in that study which may have been problematic to the analysis of the data, but definitely the conclusion of that study was that frequent sexual activity reduces the risk of prostate cancer. Other risk factors, there aren't really many apart from age. I mean, age is the key risk factor for prostate cancer. It's more common as you get older. We see it in men from the age of the early 40s onwards, which is why we screen from the age of 40. The youngest patient I've come across is 38. So we can't rest on our laurels and assume that if we're younger than 40, we're definitely not at risk. But majority of men over 40 is when we see the majority of prostate cancers. I think a high inflammatory diet, so diet high in animal protein, may put you at a slightly higher risk of cancer in general. And I think that high risk of inflammation in the prostate, so prostate infection, recurrent inflammation may predispose you to a risk of prostate cancer as well. But really, age is the key factor. And certainly you don't find many doctors writing prescriptions to go out and have more sex. But if you're sexually active, then you're doing one thing to help protect your psychological and your prostate health. I hope that answers all the viewers' questions.
Thank you very much. Thank you very much, Dr. Uri. Mr. Maziboko, over to you.
No, thank you very much, Doc. Thanks, Dr. Uri. You've given the best prescription. I'll try to go for the 21 activities. I wonder if I'll be capable to do it. But I just wanted to respond to the question that was raised regarding if only we do those tests in the clinic. Certainly we do the tests in our clinic. Like for instance, the PSA, we do it for free. This is a primary healthcare service which is for free. Also, the digital rectum examination is done for free. The question which says is, do all regions do those? Certainly they do, but we took a concerted decision to say we'll identify some of our clinics specifically to identify the rooms. That's why we call them the men's corner, and so that they can really attend to men and try to remove all the excuses men come with. Men that are not patient, they don't want to wait in the lines, they don't want to come even to the clinics, they even come when it's too late for them to come for the screening. But another thing which is been common, all of us who have been trained, some in the pharmacy schools and everything else, smoking. Smoking is really one of the precursors of all the other diseases. So people are encouraged just not to smoke. And I'm definitely not a nutritionist, but also if only we are to go to what they call it the red foods, that is anything high in lycopene. Lycopene is an antioxidant. It definitely assists. And I think Dr. Mtaung also touched on the veggies, the greens, also they contain a lot of antioxidants. So with that, I think that's the contribution I want to make. Thank you.
Madam Speaker, there's been another question on the chat line. Perhaps I can address it because I think it's a very important question here. It came through from someone who's using their cell phone name as their name, but from Leslie, who asks that he hears that without the prostate he won't have children. Does this mean that my wife may forget about me? Are there some options? Leslie, I think that's a very important question, and one of the challenges we face as doctors when we treat prostate cancer is to treat men with prostate cancer and control or cure the cancer, but without impacting on their sexual function. So certainly if you have to have your prostate removed, and I don't want to put any pressure on Dr. Motang, but maybe he would want to give a personal opinion here or personal experience. Once you've had your prostate removed, you cannot produce semen, so you cannot have children. But another worry here is that treatment for prostate cancer, whether it's radiation treatment, surgery, or hormone treatment, which are the three options we commonly use, all of them can affect sexual function. And men can have sexual difficulties after treatment for prostate cancer. I don't want men to be scared by this and run away from screening because they don't want to be faced with this. Because if you get advanced prostate cancer, it's worse than facing the challenge of sexual difficulty. And there's lots of things we can offer there. But certainly one of the advantages of robotic surgery, which Dr. Motang has undergone, is that we can spare the sexual function. And certainly in every patient I treat with prostate cancer, I try and, to the best of my ability, to spare sexual function, because that's a very important part of our lives as men. But also to respond to the question from Leslie, I think if a man is diagnosed with prostate cancer and their sexual performance and their ability to have children is put at risk, which certainly it can be, I think we must rely on our wives for support, and we mustn't think that they're going to leave us. I've never come across a man whose wife has left them after being diagnosed or treated with prostate cancer because they can't perform sexually. In fact, I find the wives are a huge source of support and inspiration for their partners when they are dealing with prostate cancer. And women have a lot of issues to deal with as well: cervix cancer, breast cancer, and they've got experience in dealing with these tough emotional issues, which us men don't deal with very well. And so I would really encourage men who are at risk of prostate cancer or may have been diagnosed with prostate cancer and who are worried about their sexual function to put the faith in their partners and to let their partners in on the problem and help them support themselves through the journey which they're going to be walking. And any cancer treatment is a journey. It starts with the diagnosis, and it's a long journey with the doctor and the family, and you need someone to walk that journey with you if you can. And that's why I think it's important to have support from your family and your partner.
Thank you very much, Dr. Uri. We've actually responded to the question that was sent directly to me. I was going to ask that. There's one of our followers who says, how can we as women support our husbands or boyfriends who have been diagnosed with prostate or any other cancer? I think you have already responded to that. I see on the chat group that we are also joined by the sexologist doctor from the Eastern Cape, Dr. Tebelele of Umhlobo Wenene. It says, Wempempe. You are very much welcome, Wempempe, and thank you very much for joining us.
Thank you, Speaker.
Maybe let me give you just a few minutes to say something on this topic. This is a very pertinent and important topic for our viewers as we are conducting civic education on this platform.
Thank you very much, Councillor, and thank you very much for the opportunity. I'm listening with interest because I was talking on the same subject on Umhlobo Wenene this morning, using Tata Mandela as an example. That's why I'm very grateful, Dr. Selom Taung, for sharing your personal experience. It's a nice sacrifice. It's biblical. It will take us a long way in terms of not only educating patients, but also helping us. Tomorrow I'll be doing my own PSA and my own digital rectal examination through your sharing. I've shared this on my Facebook. And Dr. Uri, thank you very much for the insightful talk. And one thing that is frustrating is the issue of sexual fulfillment and sexual health, and it's discouraging a lot of men in terms of taking the options of operations and radio. In terms of comparison, is which one is better in terms of preserving sexual functioning, doing an operation or radiotherapy? Which one is likely to preserve a bit of sexual functioning? And also on the chart, I've put a question there on urinary dribbling. It concerns a lot of men that a lot of them, after following post-prostatectomy, there's an element of having urinary dribbling, which concerns them because urine can smell, and also even during sex, some of them, they sip a lot of urine. And is there effective treatment for that? Thank you, Speaker, and thank you, Dr. Fundi.
Thank you very much, Dr. Debelele. Thank you so much. The treatment, maybe let me ask Dr. Mutaung, who has traveled the journey. The treatment, Dr. Mutaung, how tedious is the treatment, and also the healing process?
Thanks again, Madam Speaker. You know, as I said at the time, there had to be a determination of what treatment option would be best suited for me. As Dr. Uri said, you know, there's various options available for treatment. And again, it depends really on, number one, how aggressive the cancer is. Number two, the staging, you know, is it confined to just one lobe, or is it, you know, all over? Has it gone beyond to other parts of the body and so on? And then, of course, they take all of that into account to determine what treatment is best suited. It's more kind of, you know, individualized kind of treatment, and the choice of treatment is something that is discussed, you know, between you know, the patient and the doctor. At the time, in my personal, you know, circumstances, I was faced with the choice. So there was no way around, you know, getting the prostate removed. So there was a question of, you know, how do I do that? Is it do I undergo surgery? And of course, you look at all of the issues around, you know, what happens after surgery. What are the side effects, you know, the long, lasting side effects, and, you know, there was talk of sexual function, how best can that be preserved? And I made a personal choice at the time that the best option available at the time, yes, it wasn't available in our country at the time, it was 2011, but was available in Europe, and that's why I went, you know, through to Germany for that. Of course, I want to emphasize that, I mean, it's obviously costly. You know, it's not something that, you know, everybody you know, can afford, unfortunately. However, it is available currently to those that can afford it, you know, currently, and I think Dr. Uri can you know, shed further light on that. And then, yes, of course, just to quickly describe, you know, the robotic surgery, the one advantage, you know, with it is that it's very quick. You know, you literally stay a day or two after, you know, the operation, and you're up and, you know, about. and there's less side effects as was mentioned earlier. But again, the issue of treatment is a journey that is walked best between the patient that is undergoing treatment and the doctor that's treating that patient. Dr. Uri perhaps can add a word or two on that.
Thank you
Thanks
very
a lot.
much. Maybe Dr. Uri, as you are adding one or two, also respond. I think Dr. Tebelele asked the question on the urinary dribbling post-op. Is it curable? If you could also add that. Thank you.
Well, thanks, Madam Speaker. And I'm going to just touch on a couple of things that Sela said, and I'll move on to Dr. Tebelele's questions in a sec. I agree. The discussion and the journey between the patient and the doctor will help determine what the treatment options are going to be. And those decisions will be based on the stage, so the extent of the cancer, and the grade or the aggressiveness of the cancer. When we're looking at someone with prostate cancer, we do our very best to keep their function as it is before they get diagnosed. But we are just men or women, we're just doctors. We're not able to do things as well as when we were born or when we were created. So inevitably there are implications to having prostate cancer treatment. But remember, viewers, that there are also implications to not being treated if you have prostate cancer. And in my opinion, those are far worse. You can get progressive prostate cancer, which spreads, and you can die from it. So often the man who's been diagnosed with prostate cancer has to make a decision about which way he wants to go in terms of treatment. But doing nothing is often not an option. Although in some men these days, we do just watch the cancer. So that's another complicated discussion. I tend to make decisions based on the cancer first, and then secondarily to do my utmost to preserve the continence and the sexual function. And I'll switch over to Dr. Tebelele's questions now, because this leads straight on into that. So the two big problems that men have after prostate cancer treatment really are sexual function issues and urinary control issues or continence issues. And whether you have a radiation-based treatment or a surgical treatment, you're at risk of these side effects regardless. Perhaps the side effects are a bit different in that with surgery, they tend to occur straight away and get better over time. With radiation, as the effect of the radiation builds up in the tissues around the prostate, the effects accumulate and the functioning tends to get a bit worse over time. But there are things we can do about these problems, so it's not without hope. Firstly, with the urinary control matters, we can get men to strengthen up their pelvic floor muscles. Now, the ladies who are listening will know a lot about pelvic floor muscle strengthening because they have to do it a lot when they're pregnant or post-pregnancy. So we can teach men physiotherapy to improve their pelvic floor muscle strength. We can give them pads, which will help protect them against the leaking of urine for a while. But to be honest, most men can achieve satisfactory continence after sort of 6 to 9 months after treatment. In the few men who don't, there are small procedures we can do to improve their continence. In my experience, men who are treated for prostate cancer, generally we can get them to a satisfactory point where they don't have significant problems with continence. There are men out there who struggle, and we do our best to manage that, but certainly most men we can get continence controlled. In the men who have sexual function issues after prostate cancer treatment, we've got options in terms of medication to improve the blood flow in the penis. So that's the medication like Dr. Tebelele mentioned, Viagra, Tadalafil, Sildenafil. I don't know if I should mention them by trade name, but it certainly improves blood flow, it improves sexual function. We have access to a number of other treatments ranging from mechanical devices, injections into the penis, and that sounds scary, but it's not really as scary as it sounds. And also prosthetic implants which we can put into the penis. So there are a number of options. Basically what I want to say, I don't want to spend too much time on this, Madam Speaker, but maybe to say to men, it's not all doom and gloom after prostate cancer treatment. We can do our very best as doctors to get you to a point of satisfactory continence. We do our very best to preserve your sexual function. They are put at risk by treatment of prostate cancer, and certainly it is something that will be discussed between you and your doctor when you get treated. And really the take-home message here is that there are implications to being treated for cancer, but probably in most men, the chances of worse complications if you don't get treated and of dying younger, and this touches back onto the question we had earlier about why men live shorter than women. I mean, if we don't treat cancer, then certainly you're not going to be around for a long time to enjoy your sexual function, your urinary continence. So I generally would recommend that men get assessed, get diagnosed, and then they can have an informed discussion with their doctor about how they would like to treat the cancer and what the risks of that treatment are, and then they can decide what they'd like to do. And as Dr. Svello said, it is a bit of a weighing up, and he's walked that journey personally and made that choice. And every man who gets diagnosed with cancer, unfortunately, faces a similar sort of choice. Svello, do you want to add anything else there?
No, not really. I think we've covered everything. I think the important message today should really be on the screening and early detection, because that's when, you know, if it's detected early, that's when somebody has a chance, you know, of survival. I mean, it's, you know, looking back, it's 10 years down the line. I've even forgotten about the fact that I've ever had, you know, cancer of the prostate.
I agree completely. So, and if you detect it early, not only do you have a better chance of cure, but you have a better chance of preserving your urine control and your sexual function. The more advanced the cancer is, the more difficult it is to save your functional side of your urinary system and your sexual function.
Wow, thank you very much. Doc, I'm not sure our technical team, how much time do we have? Sipo tells me that there are more comments from the audience, so I'm not sure whether we can take maybe 3 minutes for the comments before the panelists can do their parting shot.
Yeah, no, I think let's deal, because I think the interactiveness, that's what we want to hear from the people. So as long as, obviously, I mean, we need to have a limit, you know, so we can drive it for the next 10 minutes, 15 minutes, you know, because I think it's good to do a show where people are actually interested in the subject and they're asking relevant questions. So I would say, you know, just extend it, you know, there's no problem there. I think there was a question that was asked, which I thought maybe Barbara could answer very well, around the training of nurses at primary healthcare level in the context of the Phakamisa project.
Yes. Okay, thank you very much, Doc. Maybe let me give it to Barbara Nell to respond to that, Dr. Nell, then we'll go to our viewers.
Yes, so thank you very much, Mr. Longa, for that question. And yes, we are absolutely looking at things like this. So I think in the first instance, we're starting with training with some of the nurse specialists, but we will definitely be looking at areas where we can further empower and drive the knowledge for a primary healthcare level. So similar to what we're doing with another program that we are currently running with the National Department of Health and KwaZulu-Natal around screening for hypertension, where we are also kind of upskilling the community health workers as they go into the communities, what they need to do. We should also be looking at how we enable people kind of at the clinics. So definitely something that we can look at. And, you know, if we need to kind of come knocking on a door of a province or an area where we are able to do something like this, and, you know, how do you enable the clinic in terms of maybe pamphlets and information that is there for patients to take? And how do we also enable the nurses or the staff at the clinics to be able to at least do some initial screening to potentially then refer the patient, for instance, to a place or a venue where they are able to then do PSA screening. So definitely things that we can look at, and very much where we want to continue to work in partnership with our partners to also guide us and tell us as AstraZeneca what more we need to do. And, you know, as I say, I've got my colleague Ruth Field on the line as well this evening that is very much also looking at those next steps in terms of what we can do. So thank you very much for that comment.
Thank you very much. Thank you very much, especially on your call to partnership, Ms. Snell. I think we can also partner as we do civic education and with civil society programs. So we will partner. We'll have to communicate with yourself after this on your project, Phakama. Sipo, can we hear what viewers are saying? Just few comments.
Yes, Madam Speaker, thank you very much. The first comment from Kwena Jr. says, progressive staff comrades. Hlubi Ntamehlo says that's true. Men are reluctant to seek medical care. Mostly they opt for over-the-counter treatment. They only seek medical attention when they are very ill. We encourage men to visit our primary healthcare clinics for health screenings and early identification of health problems and prompt treatment. She goes on to say, thumbs up, Mr. Mazibuko. Sfiso Mbata says, Men's Forum in Alex meet every Thursday to dialogue about men's health and also an awareness about prostate cancer. And thanks to Mr. Mazibuko for informative information. Then Rulani Nkwanazi says, in America, about 12,000 doctors discovered that cheese, a food product, is also contributing to a cancer risk. What is our SA official opinion about cheese? That's the last one, Madam Speaker. Thank you very much. Please unmute, Madam Speaker.
I'm muted, all right. Thank you very much. As I will be calling upon our panelists to say their parting shot, I would request you to also respond on the cheese issue. I'm one of the fans of cheese. So may I then request Ms. Babranel just to do your parting shot, also in response to the comments and questions that Sipho has just read.
I think from my side, I think it's just thank you. It's a thank you for this fantastic platform. I think such interactive discussion this evening. And we are looking forward to find the ways of how we can also take this further. You know, our commitment is there in terms of what we need to do around communities and around raising the awareness and having discussions and facilitating discussions like this evening to drive the awareness and to create the platforms for people to have these questions and hear the answers and learn from the experts. Thank you very much.
Thank you very much. Thank you very much. Let's hear from Dr. Mtau, your last message.
Thank you very much, Madam Speaker. So for me, I really just would want to re-emphasize that point around screening. You know, to say as men, especially if you know you're high risk, it's very, very, very important, you know, to screen, get examined once you get to the age of 40 or earlier, as the doctor had said, you know, make sure that you get screened at least once, you know, at that point. Because if the cancer is detected early, you have a far better chance of, you know, an almost normal life even after treatment. Just on a personal note, you know, more than 15 years ago, I lost a personal friend to prostate cancer. And unfortunately, because at the time that we got to chat about what exactly was wrong with him, he had backache. And backache was a result of, you know, the cancer having spread to his lower back. And from then on, it was just a downslope until, unfortunately, he passed on. So I just want to re-emphasize the point around early detection and screening, and of course, continue living a healthy lifestyle. Thank you very much.
Thank you very much. Early detection, screening, checkups. Thank you very much, Dr. Mtau. Dr. Uri, your parting shot,
Yes, Madam Speaker. Just before my final insight, there was one question we didn't answer about human papillomavirus and vaccination in boys. I think actually that's a very good idea. I don't think we've implemented it officially in South Africa yet, and perhaps Dr. Nyati can sort of add something on his final point there. But certainly, I think it will help our young men as well if we can start vaccinating them against HPV. In terms of prostate cancer, men out there, don't be scared of it. Don't be scared to be checked. Come in for screening when you don't have symptoms. If you wait till symptoms, it's too late. And don't be scared of the consequences of treatment of prostate cancer. As doctors who look after men with prostate cancer, we walk this journey with you. Bring your partners with you, bring your family with you. We will hold your hands in this journey. You're not by yourselves. That's my take-home message, I think, Madam Speaker.
Thank you very much, Dr. Uri. To our listeners out there, if you are diagnosed, it is not the end of life. You can still survive, but get checked, get checked, get checked. Mr. Mazibuko, your parting shot, and also just to also talk on the men's health. I had comments of people commending you for having your men's forum in Alex. Do we have men's forums in all the regions? If not, how can other regions copy from your region?
Thank you, Madam Speaker. I think most of the colleagues have really emphasized the most salient and important points regarding the early detection and screening. And certainly, I think this platform gives us the opportunity to just call out the men out there to say, please let them come forward. There's so many other issues and so many other ailments. If only they're detected early, there can be intervention and a successful intervention. Regarding the Alex Men's Forum, certainly it's kudos to them, a big up to them, because these are men who are very, very dedicated to it. I thought at one stage or another it would die a natural death, but it's still striving. And to us, we can only say thank you very much. And they're actually taking matters into their own hands, and to us, it's very, very heartening. I know that in other regions, certainly they're trying to establish this men's forum, but what's very key, under the Johannesburg, the Banner Johannesburg AIDS Council, we're really trying to establish what we call a men's parliament. And it will cover all the issues, not only HIV, all other issues. And it will be all the sectors, youth and women, men, and all other issues. But specifically here, we're looking at men because there are some other social ills which men are faced with, maybe due to their poor mental state. There's GBV, there's HIV, there's a couple of things which men they are besieged with. And we hope that if only through this forum and others, if these matters can be bring to the forth and men partake in all the discussions. Thank you very much, Mr. Speaker.
Thank you very much, Mr. Mazibuko. Men, prioritize your health, look after yourselves, screening, testing. I think all our panelists are emphasizing on those areas. Dr. Nyati, your parting shot, please.
Yeah. All right. I was about to say that men must prioritize their health. I think it's important for men to understand that the top threats to their health aren't secrets. They are known, they are common, they are preventable, right? And something that Dr. Yuri talked about, the issue of human papillomavirus vaccination. We know that here in South Africa, girls in schools between the ages of 9 and 13, that is pre-sexual, they actually get vaccination through a government program. But obviously boys who are actually the ones who experiment with these girls actually do not get that vaccination. In other countries like Australia, the program of vaccination with for HPV is both for boys and girls. So I think it's a policy decision that our government needs to look at, because it actually makes sense to vaccinate both boys and girls. But yes, we are starting with girls. It's been almost 10 years now. I think it's about time that our boys are included as well.
Thank you very much, Dr. Nyati. Thank you very much for this informative session. Thank you to all our guests. Thank you to the listeners at home for participating in this important topic. Thank you to the community radio stations for broadcasting this engagement. The conversation on men's health does not end here. In fact, it really should be accelerated so that more and more men are brought into the fray. We trust that more and more of our men will go get tested, because early detection, as you heard from our panelists, saves lives. So let us please go and screen. Let us meet again, ladies and gentlemen, next week, same time, same place. And let us remember that we are still in the middle of a pandemic. So please mask up, sanitize, and stay at home. To all our panelists, bravo. Thank you very much. I love you all and good night.
Thank you.
Thank you, Madam Speaker.
Thank you, Madam Speaker. Thank you all.
Good night, everyone.
Thanks, everyone.
Thank you, Madam
Bye.
Speaker.
Thanks, everyone. Thanks, Madam Speaker.
Thanks,
Bye,
Madam
everybody.
Thank you so much. Thank you. Bye. You have a good night.
All right.